Clinicians from St. Lucia and the wider region are attending a 3-day workshop on HIV/AIDS and tuberculosis management. The training session comes as the region moves closer to realizing the United Nations goal of eliminating the diseases by 2030 and 2035 respectively. The advisor to PAHO and the World Health Organization says it is fundamental that medical practitioners have a firm grasp on the effects of the diseases on patients and their immune system.
These cells are known as CD4 and macrophages. So when individuals their immune system is broken, they are susceptible to infections. In the last 30 years, we have been working on HIV, and HIV and TB are a kind of tsunami where one fuels the other one. Our TB epidemic in the Caribbean, even though it has started to decline, in some population group, especially who are affected with HIV, is still very high. So some of the countries in the Caribbean, like Haiti, Dominican Republic, Jamaica, Trinidad and Tobago, do have higher incidence of TB. The Eastern Caribbean countries are the one where we have lower incidence of TB and HIV as well. So our goal is, as you know from the Millennium Development Goals, the last 15 years, to reduce by half TB and then also to halt the spread of TB and HIV.
Dr. Gibra says harmonizing care and treatment will result in successes once thought impossible. Already, the Caribbean has recorded steady decreases in new cases of HIV/AIDS. However, stigma and discrimination remain major hurdles, but targeted programs are breaking the barriers.
So we have 15 years to go, and then we wanted all people who are HIV infected to know their status, and those who know their HIV status to access treatment, at least 90% of them, and then once they are on treatment, to have their virus suppressed. That meaning they will not be transmitting HIV to other persons. So through that mechanism, once people are on treatment, the HIV transmission will be minimized. So this is our approach based on evidence, and then we are confident we'll be able to meet this target by 2030 and by 2035.
And St. Lucia's Senior Medical Officer for Infectious Diseases, Dr. Alicia Eugene, believes the targets are achievable.
We as OECS countries and other countries in the Caribbean, we can look at our guidelines and see how we can tweak it to make it better, so we can better our HIV/TB clinical management for our patients. In St. Lucia in particular, we plan to decentralize. When I mean decentralize HIV and also TB care, we're looking at, for HIV, for instance, a patient who's HIV positive should have the ability to come or have the access to see any doctor at the healthcare facility and get treated. They don't need to go to particular points to get treated. A patient with HIV and TB will be admitted. That patient will be seen, but after being seen at the hospital and treated, will eventually be discharged to the other parts within the island. And that patient being discharged within St. Lucia should be able to gain access at any healthcare facility, especially within the same region. Why we did the HIV/TB clinical management together is because TB is a co-infection. It happens, and a lot of patients who tend to have HIV, the immune system tend to be low, and they could easily get TB. So we have to be prepared that a patient with HIV and TB can be properly managed, not only in hospital, but when treated at hospital and sent in the community, they can also be managed appropriately.
The workshop is being held at the Bay Gardens Inn.